Ligament.
Section. Axial skeleton. Skull. Axial skeleton. Skull. Six. Axial skeleton. Spinal column.
All right. So y'all don't have this, right?
No.
Okay. All right. So now we're gonna look at your spinal column. So you need to know that the spinal column consists of 26 bones called the vertebrae. So if you look at your skeleton, that's questions, I think, but it won't let me print.
No, I'm just saying simple question.
If it's an attack game, usually you clicking on stuff and it took a day too long for that.
It's long.
It took too long for my patients, but it's probably not long. All right. So if you look at the skeleton, and we have one here. Let's just turn around. We have one here. All right, so you have your vertebrae, your spinal column here on the back, on the dorsal or posterior side. All right, so it encloses and protects your spinal cord. It supports your head and your trunk. So if you really look at it, you can tell. Like you have your spinal cord, you can kind of see it in there. But like we said, bones are for protection, so it protects your spinal cord. All right, so and it supports your head and the trunk of your body. So you have disc of cartilage tissue that separate the vertebrae to cushion the bones and allow for movement. Because remember, you don't really want bone on bone. That's kind of like after a while, after rubbing together, stuff's gonna start wearing away. So I don't know, you can't. Well, you can see it from the front. These little discs to keep them from like rubbing on each other. And then so you have these are your vertebrae. So you have 7 cervical, so are your neck ones. And then you have, remember I don't think we talked about it in here, but your thorax is your chest. So you have those ones behind your chest. So there's 12 of those. You have lumbar, that's your lower back. You have your sacrum, just here. And then you have your coccyx or your tailbone, which is this little one on here. So when people say that you break your tailbone, that's what they're talking about. That little bitty bone at the bottom. It looks like a tail. If you really look at it, it looks like a little tail you got. So when people get paralyzed, that's what, like, if you've ever heard of like a C1 fracture, LT, that's what they're referring to, like cervical, lumbar, thoracic. When that letter in the front is, they're telling you which one they're talking about. So it depends because these are your neck. So a lot of times something happens to any of these, they're gonna be like probably paralyzed from the neck down. Like if they hit it, injury, something like that, then they'll get paralyzed. So it just depends on where it is. But that's what they're talking about when they're saying what kind of fracture, which is a break in the bone, what kind of fracture they have, and they say C1 or T4 or whatever. They're talking about which one of these according to where it's located on the body. So cervical, thoracic, or lumbar. Usually if they say they broke the tailbone, I just say they broke the tailbone. All right, spinal column consists of 26 bones called what?
Vertebrae.
So you got your vertebrae. What's the name of the bones for the chest?
Thoracic.
Thoracic. So that's what thoracic means chest. What's the name for bones of the lower back?
Lumbar.
Lumbar. Right. All right. So, what are these?
Cervical.
All right. What about these?
The thoracic.
Okay. What about this?
That's the disc. Inverted disc.
Intervertebral disc. Right. And then you got these.
The lumbar.
So you got your lumbar. All right.
Sacrum.
So you got your sacrum here. Hold on.
But it's not like
All right. So you got your sacrum, and then you got your coccyx or your tailbone. So you got your cervical up here, which is your neck. You got your thoracic, which is your chest. Because you think about your chest, and these are behind. So remember, your heart and your lungs sit here.
You can get your partner's interruption for you morning announcement. Students, today, make sure that you get your classes on time. Make sure you stay inside of your classroom. Today is Friday. You essentially have a 3-day break away from school, as Monday is an asynchronous day. So let's try to get through the day without incident. Make sure you follow directions, be respectful, and just do what you need to do. Make sure you get to class on time. Teachers, please make sure if any student leaves your class, they have a pass wherever they're going. Time stamp. Also, today, baseball and softball will open up their season, as softball will play in the Brew Tech tournament at 3:30 at Ray Thornton Park. Baseball will play at Lamp today at 2:45. So students, when you get out of school, please go and check them out and support the team. Also, Youth and Government will be having their 6th annual mock election. It's going to be virtual this year, and their voter registration drive. The date for the mock election is Tuesday, February 22nd at 9 a.m. On yesterday, I sent out an email as well as I posted in the Schoology the link for students to go ahead and vote. For students, please go ahead and vote, as the election will be on February 22nd. The voter registration drive for all seniors and communities will be February 25th to celebrate Black History Month. If you want to be a member of the 2022 JD football team, sign up is happening now. The deadline to sign up will be on Monday, February 21st, 2022. They are currently working out and conditioning Monday through Thursday, 3 p.m. to 4:30 p.m. The spring game will be in May versus Park. Sign up before the deadline. Sign up with Coach Bell, Coach Adams, Coach Gary, Coach Sanders, or Coach McKnight. Lastly, students, the class that are in the gym today, as of right now, are Ms. Edwards, Ms. Hamilton, Edwards, Richards, and Couch. So when we move, you need to go directly to that class, whatever class period you have in. That's Edwards, Ms. Edwards, Hamilton, Richards, and Couch. Everyone else report to your class and follow the directions that's on the door. Hope everyone has a great day.
that whole hallway's not here.
Who?
Yeah.
Oh,
That whole hallway's out.
Where hall is it?
The hallway that you come in when you like by the gym.
Oh, really?
I think the only
They
person
keep
is
whatever
Miss
they
Bryson.
got over there.
And that
Bring it over here. Okay. So, like I said, you got your cervical, thoracic, you got your intervertebral disc, you have your lumbar, which is your lower back, your sacrum, and then you got your coccyx.
Axial skeleton.
All right. So, the thorax is also known as the chest cavity. It helps to protect the heart and lungs, which I think when we did medical terminology, I think I have made y'all write that down anyway. So you have 12 pair of ribs or costae. So just know you have 12 pair of ribs. You have 12 pair of ribs. What testing we got? We got testing next week? What kind of testing we got?
Testing. Really? For twelfth graders. Yeah, no one said anything about testing. Nothing too. No, we already did our like a testing during the school year. Unless it's a pre-AP season. I couldn't remember last year. So that's the long 3 hours.
When we get there, we're gonna cover a couple of things. One, you're gonna have a test on Wednesday. You got a test Wednesday. Go ahead and write that down.
Excuse me, did you want to give the announcements? Please do not write passes for students to go visit other classrooms or just to go to other classes. Only passes should be written if a student has to use the restroom. Again, please do not just write passes for students to go visit other classrooms or just go to other classes. They're in your class, they need to stay there. Only path that should be written is if they need to go to the restroom. Thank you.
Alright, so we're gonna take a test. We'll take your test on.
And only one at a time, if you have the right path into the restroom. Thank you.
Alright, so if you, we're gonna review, because remember we got a test on Wednesday. The test on Wednesday on what? Reflection and translation. So your test on Wednesday is on translation and reflection. So let's get to talking. First off, we're gonna start with translation. You got your notes, so take your notes out. Take your notes out. So translation, what do we know
Fall
about translation?
assessment. I don't know what that is.
You have your notes.
Advisement. There's no, I don't see no testing on here.
Alright,
So
translation.
work keys not till March. ACT is in April.
What do we know about translation for what?
I don't know what they got going on. Alright. So you have the first 7 pair of your ribs. They are called your true ribs because they attach to your sternum or your breastbone. So if you look at your skeleton, the first 7, so this is your breastbone, this is your sternum, so they attach. They attach here by this cartilage. They attach directly to your breastbone. Alright, so you have the next 5 pair are called false ribs. The first 3 pair of these ribs each attach to the cartilage of the rib above it. So if you see here, they're attached to the rib above it. That's what I call the false ribs. And then you have the last 2 have no attachment on the front of the body. So they are called your floating ribs. So you got floating ribs, which are here. They don't attach at all. Well, you probably can see them this way. They don't attach to the front of the body. So they're called floating ribs. Because it kind of looks like they're floating. Alright, so then you have your sternum. Just know sternum is your breastbone. Which sternum is your breastbone. It doesn't say it there, but. So sternum has 3 parts. You have your manubrium, your gladiolus, and then you have your xiphoid process. So the top portion or the upper portion is the manubrium. So it's attached by ligaments on both sides to the clavicles or collarbones. So it's this little piece up here. Attaches up here to your collarbones. That's your manubrium. Then you have like the body of it, which is your gladiolus, and then you have your xiphoid process. That's the small piece of cartilage that's at the bottom of it. So this little piece right here. So you got your manubrium, your gladiolus, and then you have your xiphoid process right there. So when they're doing open heart surgery, this is where they're gonna cut.
So they cut the bone.
Yes, they cut and then they stretch it open like this, hold it open so they can get in. So if you ever see anybody have heart surgery, they gotta align because of where it's been cut down.
What are we doing? 4 units to the right. 1, 2, 3, 4. 6 units down. 1, 2, 3. 1, 2, 3, 4, 5, 6.
So if you look on this picture here,
Same thing with C. What are we doing? 4 units to the right. 1, 2, 3.
so here you have your
1, 2, 3, 4.
you have your sternum or your breastbone. So you have that top part, which is your manubrium. You have this part, which is the body or your gladiolus, and then you have your xiphoid process.
Just translate that image.
And then your true ribs, and then your false ribs. And you can see how they look like they're floating back. Well, you can see one of them clearly, and the other one right there, you can't really see it.
Use your formula. What do we know about A? Tell me the order pattern A. What's the order pattern A? AU4.
And then what, like, so that's why when which y'all will learn CPR in a few weeks, or probably sometime in March or maybe April. When we do chest compressions on people for CPR, sometimes we do break the ribs, because you gotta think about you pressing down on somebody's chest, so the ribs will break. I'd rather have broken ribs and be dead, to be honest.
Okay, but
So
what if you doing CPR, you break that rib, then they rib comes out?
6 plus a negative 6. What do we get?
that doesn't really happen. I mean, you can fix it. You can fix it. They're gonna have to go straight to surgery once we get them stable. Got to make sure their heartbeat is there before we take them. I mean, I've been there where, like, when we had a patient, because I usually work in the ICU that had the heart patients, so I work with all, like, the people that have open heart surgery. So when they came out of surgery, they've had all this cut and messed with, so it's really, really delicate. So he ended up, I don't know if he went into a rhythm, his heart went into a rhythm that we had to do CPR, or his heart stopped. I don't really remember because I wasn't in the room when it happened. But so we had to open him up basically in the room because we didn't have time to go to surgery. So we had to open him back up. And when you do CPR on people like that, we use a phone book. Like, we don't press down on their bare chest. We use a phone book over that part because you don't want to mess nothing up. It kind of gives like a cushion. I mean, it's firm, but it's just not like your hand pressing straight down on their chest. So the surgeon had to come in. We had to open him up. So I'm right here because I'm breathing for him, of course. So I'm, breathing for him. And the surgeon was right beside me. And I'm looking down, and I just see his little heartbeat. I'm like, oh, wow, look at that. So that was interesting. So, but it's neat. Sometimes it is. Can be neat. It's a great learning experience. All right, so why are some costae called false ribs?
That's translation.
Right. They're attached to other ribs, or they have no attachment. What's the name of the breastbone? Sternum is your breastbone, right? All right. So what is this whole thing? So that's your sternum. All right. What about this? Manubrium is the one at the top. This one. The gladiolus. So your xiphoid process right there. All right. So what about here? True ribs. So you got your true ribs here. And then you got your false ribs over there. So that's what it looks like.
Appendicular skeleton.
All right, so your appendicular skeleton, you have what's called your shoulder girdle. So it's also known as your pectoral girdle. So you think of your pectoral muscles. So you have 4 bones: clavicles, which are your collarbones; scapulas, which are your shoulder bones. Just know what clavicles and collarbones are. Good way to remember: clavicle starts with a C, that's your collarbone. Scapula starts with an S, that's your shoulder bone. So clavicles are collarbones, scapulas are shoulder bones.
That's the rule. Get it right there. Alright, so I give you this one, says 6 units left. What you gonna write? The rule. All you supposed to do is write the rule. What are you gonna write? Under parentheses. X, X what? X what?
So your clavicles help brace the shoulders and prevent a person from having too much forward motion. So it's kind of like I guess like a balancing type of thing. And then your scapulas provide a place for the arms to be attached and together with muscles that assist with arm movement. So if you look at your skeleton, up here you have your collarbones,
Because the only thing we did was move
and then you have your scapula or your shoulder bones. Remember we talked about these are like flat bones.
you gotta be able to write the rule. You got it? Okay. So if I give you
All right, y'all got that?
appendicular skeleton,
All right, so
the rule,
with your appendicular skeleton, you have your humerus, which is your upper arm bone, and then you have your ulna, which is your lower arm bone, and then you have a radius. So one way to remember, because once we start, you learn how to take pulse and all that stuff. Your pulse is where you feel your heartbeat in wherever, because you can take pulse in different places. So I draw blood from the radial artery. So I know that I know it's on this side, it's on my thumb side, because that's where I'll feel, and that's where I'll stick my needle if I'm taking blood. Then your ulna is on your pinky side. That's your ulna bone. So you got your radius bone, you got your ulna bone. Now, with like your arteries, and we'll start talking about that, we'll talk about circulatory system, but they run beside each other. So some people most times when you go to the doctor, they draw blood, they're getting it from your veins. I, on the other hand, because I'm a respiratory therapist, I need blood that has oxygen in it. So I'm going to get the arterial blood, which is, what you stick where the pulse is. Which we'll talk about that when we talk about circulatory system. All right, so you got bones in your hand. So you have your carpals, which are your wrist bones. So you have your carpals. You have your metacarpals, which are like in the middle, and then you have your phalanges, which are your fingers. So you have carpals, metacarpals, and then you have phalanges. So I think that's something y'all had to label. So this is your humerus here.
Yeah,
This
they
is
just
all
call
about-
them different types of phalanges. There's the proximal, the intermediate, and the distal.
Oh, yeah. So carpals are your wrist bones. So people that do repetitive motion, that like have like a job where they type all the time, their hands are always like this, they might have carpal tunnel syndrome. So these are the bones that are affected. They might have to wear like an arm or wrist thing, brace. So your phalanges, your toes are like just like your fingers. Your phalanges also call your toes too. What's the name of the collarbone? Clavicle. And then what's the name of the upper arm bone?
Humerus.
So you got your humerus, right? What's the name of your wrist bones?
Carpals.
Carpals.
Alright, what's another line reflection? X-axis.
All right. So what's this?
Clavicle.
So that's your clavicle.
Alright, so we doing X-axis. That's what we do. X-axis.
Wow, this
Your scapula.
So we did
scapula.
the X-axis
Watch this in
side
order.
of the Y what? Alright. X-axis
So you
side
got-
of the Y check.
Humerus.
So you got your
Right,
humerus.
yeah. Y equals X, Y axis, X axis. Do we have another? Say it again.
What's this
That's
one?
your ulna.
So it's on your pinky side, your ulna.
Y equals negative X. How does that look?
And then,
Your radius.
One like this.
like, you got your radius.
Alright? So how does that look?
So I gotta stand on top of the thing. Alright, so these carpals.
Which side y'all going out and talking? If we got it, I don't have to review.
So you got your carpals, you got your metacarpals,
And your phalanges.
and your phalanges.
Let me switch them. And we change sign. Switch them and we change sign. That's why he was negative X.
Appendicular skeleton, pelvic girdle.
Alright, so you have your pelvis.
X equals
You have two os coxae or your hip bones. So you have your hip bones here.
what is K?
And they attach to your sacrum. Remember, your sacrum is, on your vertebral column in the back right there. Your sacrum here. And connected to each other at a joint called the symphysis pubis. So each one consists of 3 fused sections. So you have your ilium, your ischium, and your pubis. So the pelvic girdle supports the trunk of the body, and particularly the lower soft abdominal organs. Because remember, you have all these organs in your body that need to be protected. Because they're not protected, like you can be easily, they can be easily injured or hurt or whatever. So you have all these skeleton, these bones that help protect these different organs of the body. So it also provides a place for the legs to be attached.
Appendicular skeleton.
All right. Femur, also called a thigh bone, it's the longest bone in the body. So write that down. So the femur is the longest bone in the body. And also know that your patella is your kneecap. So your kneecap is called the patella. So you have your tibia, which is the shin of your lower leg. And then your fibula is, also in the lower leg. So femur is the upper leg. It's the longest bone in the body.
Those are 6 lines of reflection, right? Or lines of symmetry, whichever one you want to call them. Alright, so we got that? Okay. So once we know that, because you probably will have to identify your lines of reflection. So when it says that, all you do is just identify where this line of reflection is located. That's all you got to do. Alright? Then you'll have problems that say something like this.
All right, so then you have bones in your foot. You have your tarsals, which form your ankle. That's kind of like your carpals and your So you got your tarsals instead of carpals. They're called tarsals in your foot. So that's kind of like where your carpals are in your hand. And then you have your metatarsals, and then you have your phalanges, which are your toes. So you have your tarsals, your metatarsals, and then your phalanges. Oh, and I turned your leg around. I'm sorry.
How far is B from the line of reflection? 1, 2, 3, 4, 5 units away, right? So that means when I reflect it, I'm going 5. 1, 2, 3, 4, 5. That's my B what? Next, I just reflected.
All right, so how many sections are fused to make up each of the os, coxae, or hip bones? Okay. All right. Which is the name of the upper leg bone in the thigh?
Femur.
So that's your femur. What's the name of the shin bone?
Tibia.
Right, it's the tibia. Name of the bones for both the toes and fingers.
Phalanges.
Those are your phalanges, right? Uh-oh.
joint, joints,
We talked about joints a little bit already. So you got three classes. You got the diarthrosis joint that's movable. Amphiarthrosis is partially movable, and then you got synarthrosis, which is not movable at all. Area where two or more bones connect is called a what? So you got a joint.
How far is D from this line of reflection? 1, so it's 1 here. D is the same way, right? So we got D prime and D prime.
All right. So which one is movable?
The diet.
So diarthrosis. What about partially? So and then not movable synarthrosis. Right.
lesson summary,
Alright, this section is short.
what you'll learn,
We're just talking about diseases and disorders of the skeletal system.
arthritis,
Alright, so when one or more joints are inflamed, it's called arthritis. Write that down. So that's when people have arthritis. So that's what I'm talking about. When their joints are inflamed, that's arthritis. So cause for arthritis is not known, but some causes may include joint disease, infection, or trauma. So you have two common types of arthritis, or the most common types are rheumatoid arthritis and then osteoarthritis. So with rheumatoid, the body's immune system attacks its own tissue at the joints. And then osteoarthritis is also known as degenerative joint disease and usually occurs with aging. So that's something that happens as you get older. It could happen as you get older because remember, oste is bone.
Stop it. Just stop. Alright, so this is what we got. So you gotta do two things before you
sprain,
Alright, so a sprain is when a twisting action tears the ligaments at a joint. So know that. So a sprain is when a twisting action tears the ligaments at a joint. So a sprain can be sudden, can be caused by sudden or unusual motion. So you're doing something, playing something, you might sprain one of your bones or whatever. So symptoms of sprains are pain, swelling, limited movement of the joint. Treatment involves resting it. So elevation, that means propping it up, like putting it on pillows or something like that. Immobilization with a bandage or splint. Anti-inflammatory medication, so that's like ibuprofen, something that's anti-inflammatory that's supposed to reduce swelling. And then alternate application of heat and cold, so you can put ice pack on it or put like a heat pad or something like that. Bless you. So that's the treatment for a sprain. Did anybody ever sprain anything?
Oh, I do it all the time to my head.
I sprained my wrist before. Sometimes sprains hurt worse than like a break, an actual fracture, they say. Yeah, mine, it'll like ache sometimes. It's been a couple years, but.
Go ahead and get on your sheet that I gave you. The back side, you see your name. This what you need to be writing.
dislocation,
So dislocation is when a bone is displaced from a joint. So write that down. So if you dislocate something, that means that it is displaced from your bone comes out of where the joint is. It's typically caused by trauma, but it also may be inherited. I think it's some kind of disease or disorder where that happens a lot, I think. It often occurs in shoulders, fingers, knees, and hips. Treatment involves reduction or the return of the bone to its proper position, immobilization with a splint or cast and rest. So people will pop stuff back into place when it gets to be dislocated.
Alright, so can we see you good? Can you write? Okay, here we go. Stop talking. Okay, so even though it says you can do a rotation, I want you to understand that's what we're doing. We're doing rotation. All your notes are gonna be about rotation. Okay? That's what we are. That's important. A rotation is a change in
Fracture.
orientation.
All right, so a fracture is a crack or break in the bone caused by trauma. So write that down. So that's what, like, if you break a bone, that's what it is, a fracture. So a fracture is a crack or break in the bone that's caused by trauma. So with a fracture, with a broken bone, so you'll have pain, swelling, and also bruising can occur. So treatment involves resetting the bone and immobilization with a cast or traction. So that's when people, get put in casts. They might have to. It's this thing called a traction. It kind of like pulls things back together.
Size, gotta change the size. Gotta change the size. Let's go right now.
All right, so you have different types of fractures. You have one that's called a green stick. So green stick fracture is the bone is bent and split but does not completely break. So it doesn't completely like break into. Then you have a simple or closed one. So the bone completely breaks but does not pierce through the skin. You have compound or open. The bone breaks and pierces through the skin, which can lead to infection. So it'll break and a piece of it will stick through the person's skin.
I just don't understand bones.
You don't understand bones? Why? Hello? Huh?
Pardon the
Yes.
interruptions. I need Leonard Bailey for checkout. Leonard Bailey.
Stop talking. That's what you do. You do too much of that.
Can I go in there to what now?
There you go.
No, what did you say before that? I thought you said irritate. That's why I was asking. Okay. If it happens, because I don't know.
Counterclockwise, your CC
That happens next.
CW.
Yeah.
Also, I need to
That
hire
is
him
just
a
been
call.
saying it's not.
Checkout. He's in
So
the
I don't know
library.
though. Yeah. Okay. So what y'all understand about it?
Because like why I got blood in it? I ain't gonna have. I thought it was just bone, like a tree. You know how a tree like this now?
What you mean blood in it?
Like I'm kind of like you said it make blood cells
Produce them, yes.
in the bone or like to the body.
I think to the body.
Oh.
Now, that's a little bit above my pay grade, but I think so. But I'll find out for sure because I don't know. It's something I'll look up. But all that kind of, everything kind of works together in the inside. So Are y'all those people that like to watch like videos of people stuff break? I mean, not watch them, but so I watch like YouTube of sports injuries where they break their bones.
Oh, why would you do that?
No, that's weird.
Why not?
Cause that's weird. You want to see somebody in pain?
I don't say I want to see them in pain. You what? What you say?
That movie crazy.
Final Destination movie.
Bro,
I was
I
She
watch
was on
it.
that thing and her bone like
Oh,
I don't
how
know.
many Final Destinations is like?
Three.
No, it's like
Three.
5.
Yeah, it's like
I probably saw the first one and that was it.
Man, you need to watch it. I watched
Like
it.
that's like when they started making all these. The original was when I was a kid, and then they started making all these other ones. I'd be like, oh,
It's good. I be watching, you know, like
but what?
what's some like I can't even think of it. It's like you know like how they be like having old cases and then they be trying to
Cold case?
Yeah, I did.
Mhm.
I'm watching it.
Yeah, I like
be
that.
watching that stuff too.
But no, it's not that I just sit up and watch it. It's just because usually when we talk about this stuff, then I'll show, cause it's sports, so you gonna see something like that. Like, yeah, we watched them in my first period the other day. They were like, "You sit here and watch this." Why not? Interesting. It's medicine. So here, this is just a compound fracture. You can see the swelling. It looks like it's painful. It does look painful.
It looks like it's oozing out
Yeah.
some nasty stuff.
So
It don't look like blood.
I don't really see it coming through the skin. It's supposed to. I don't know. It just might be the picture.
Probably put it back in
Yeah. But I mean, it's like it looks bruised here.
Wait, so they cut open the skin?
No, like when it breaks, it'll come through the skin.
Oh, and then and then they sew.
Yeah, because it's one of the sports injuries where it was the leg and his bone was like sticking out of the leg, like the lower leg.
I don't think that would be a nurse, but at the same time, it would be a veterinarian. But that's animals, it's not people. Like animals.
All right, so group of disorders where one or more joints are inflamed. So that's arthritis. Crack or break in the bone caused by trauma. That's a fracture. Twisting action tears the ligaments at a joint.
Right. And then dislocation of bone.
All right, which type of arthritis usually occurs with aging is known as degenerative joint disease?
Osteoarthritis.
So you got osteoarthritis. When arthritis causes severe damage, surgery may be performed to replace joints.
True.
Alright, it's true. Which of these conditions might treatment involve immobilizing the affected area? Right. Bone is bent and split but does not completely break.
No, wait. Yeah, that's great.
Bone completely breaks but does not pierce through the skin.
Close.
Bone breaks and pierces through the skin.
Okay.
And then splinters into more than two pieces is comminuted. Can't talk today.
Lesson summary.
All right. So we're done with notes. Y'all should have